represented by Congressman Lewis. I appreciate the service. Also, thank you for your hospitality. My opinion is probably in my work here, but I feel welcome, and I appreciate that. I think we're here kind of today to kind of talk to you and learn as well. I'll try to be very quick. I am honestly not for public option. The reason that I'm struggling to create is everyone up here today is passionate people and said things that are very emotional and they pull heartstrings in a lot of ways in my mind is correct. But we aren't setting back the things without the emotional part, which is difficult. I know this is difficult for all of us. And saying, is this the best way? I don't think it's the best way because I feel like in such an emotional issue, we need to do that as individuals, as a movement, as a community. I feel like we're outsourcing, rather your job almost, to Washington. And I feel we can be making compassionate speeches as individuals together as a community, helping our community, as opposed to outsourcing to someone in Washington where, don't take it personally, Reverend Lewis, I know that you're working hard for it, but sometimes it's lost in the right. Because I think we can all agree on that aspect. So now that says why I don't like it, I just say quickly what I think, and I'm humble as again, I don't know the answer, but what I think the answer is. I'd like to make a statement.
What's the question?
This is such a topic. So what we can do is we can produce state mandates for church companies. We have full exactly what to provide. We allow companies to sell policies across the line, keep our policies forward. And I think that'll lower policy. So thank you very much for your time. I appreciate you guys listening to me. Thank you.
You have health insurance?
Yes.
Are you satisfied with your health insurance?
Yes, I think we can do better.
Okay, all right. Great, thank you. That's all I need to ask.
I think it can be better. I think everyone can probably do better. Everyone is.
But let me just respond to this question. You could have a seat. I don't want you to feel the spot. But the fact of the matter is, you have health care. You are mostly satisfied with your health care. Under the Obama plan, under the plans that are being considered in the House and the Senate, you would be able to keep that health care that you want. But I would be able to what? Choose the public option or maintain what I have. That choice, that competition, that's the way I think it should be. And I mean, I'm just responding, I'm not debating. All I'm saying is that you are happy with what you got. And if you don't want it, if you like it, keep it. You'll be able to keep it. No one is telling you what. You got to do this or that. We want you to have a choice. And that's fine. And I think that's a good thing.
The only thing I would add is not some mandate or bid coming down from Washington. You have a choice. You like it, want to keep it, that's for your family. But there's some people, more than 46 million without anything. That's not any competition out there. When you don't have competition, you have the issue. Go to almost any major city in America. Who's building the big building? Who's financing it? Insurance companies, because they get all of the money. They're making a profit. They have a kind of a government involved. You can bring down the cost of not only health care, the delivery of health care, but also prescription drugs.
The other thing I'd like to say is there are bureaucracies in corporations and there's bureaucracies in government. So let's not just have corporate bureaucracies and allow them to exist and no other bureaucracies. No, let's make it more at least competitive so one bureaucracy doesn't control everything. And right now the private bureaucracy controls everything.
As the pastor of this church, okay, let me just say we're having it in church because the expectation would be that we would have a civil conversation. And if we can keep that in mind as we move forward, I'm trying to respect the fact that in a few moments some of our Congress will have to leave. And so I do want those who are standing in line to have an opportunity also to present their questions. And so if we could move forward, thank you very much for bringing your concern. Thank you, Congress. or responders. Next in line, please. Thank you.
I'm Larry Subley. I'm the co-chair of Able Healthcare Task Force. We did an action today at Senator Isaac's office trying to push him to support the public option. Senator Ford, we'd like to do some kind of action to keep this dialysis center open to the greatest. But on a personal level, I am an insulin-dependent diabetic, 2 different types of insulin. I'm also a kidney transplant recipient, so I have to buy the immunosuppressive drugs. I'm on Medicare, and I have a 3-part, one question. It's all related to Medicare. I would like to see H.R. 3200 allow Medicare to negotiate with drug companies over drug prices. I don't think it does that right now. I would like to see, as it stands, H.R. 3200 closes half of the Part D gap, but it doesn't close it right away. It happens over a period of years. I would like to see the gap closed completely, but if they're going to close it halfway, it should be closed sooner. And still related to Medicare, as it stands now, I have Medicare and I also have Blue Cross. My drug coverage is with Blue Cross. I'm eligible to take out Medicare Part D, and my drug coverage has a cap of $5,000. My immunosuppressants alone cost $1,000 a month. 2 insulin medicines cost over $200 a month. I take 3 medications for blood pressure and medications for other things as well. So what I would like to know is, and if I take Medicare Part D, I will have to drop Blue Cross. I will automatically drop. And I think that H.R. 3200 should stop that. I should be able to keep my Medicare coverage, because as it stands, Medicare, if I lose my Blue Cross, Medicare only covers 80% of a lot of the things that it covers. Right now, a Blue Cross pays for that. Last year, I spent $9,000 on medication. And I was retired. I was able to retire on fixed income. So I would really like to see those amendments added to H.R. 3200 coming through.
I promise you, we can do our very best to negotiate with drug companies to bring down the cost of prescription drugs, which will be part of the 3200. And I agree with everything you said, brother. Every single word. I'm with you all the way.
Driver Young, council member for Atlanta City Council District 3, and I want to thank all of you all for your service and the contributions that you make to all of our communities. I think it can be questioned, Senator Ford, Congressman, I've heard more times than not, all politics is local. I've got residents that are coming out of public housing, single moms, and there's an alarming thing happening. 2 years ago, I sat in a meeting with State Senate Majority Leader at that time, Tommy Williams, Republican senator from Middle Georgia, and he boasted and bragged how you all were able to balance the state budget on the backs of the Department of Community Health and the Department of Human Resources. And I personally had experiences with a handful of young mothers in public housing that are required at a far too frequent rate to have to go to DFACS or first take off their job and re-register for these programs, TANF, Peace Care for Kids, all these state-funded programs that are coming from funding that we get from the federal government. And I guess the national issue of health care is something that I think, I'll just say for the record, we need universal health care. But my appeal is to my state representatives, my state senators, is that engage us or tell us when we can. You come to the city hall, you all come to city hall all the time to advocate for various issues. I'm tired of seeing the state of Georgia defunding programs that are killing young mothers in and around the communities that I represent because they're They make it difficult to register for these programs, and as they get off the rolls of this public assistance, they're decreasing the budgets every year in an equal amount, claiming, well, there wasn't a need for that program, but it was just the fact that they couldn't take off work, or they get kicked out of public housing. So it's a catch-22. I guess the question I ask you is, how can we, here at the local level, ordinary citizens, help the entire state of Georgia? This is not just an urban problem, it's a state of Georgia problem, and people are dying at alarming rates of ovarian cancer, highest percentages that it has ever been in its history, especially for underemployed folks. How can we help you?
Let me